October is Breast Cancer Awareness Month, and it's important to understand how inflammation and autoimmune diseases in general can impact things like cancer. It's very common for inflammation to cause damage in cells, and damage in cells can actually further or increase the risk of cancers in certain populations. And that depends on genetics and a lot of other things that are very variable amongst people. But overall, it's important that if you have an autoimmune disease and you have genetics for increased risk of cancer, it's really important to get your inflammation down in whatever way, whether that's diet or lifestyle or exercise or just improving stress. There's lots of ways to do that. So just keep in mind that certain inflammatory conditions can increase your risk, but this is why we're bringing awareness, is to help people understand so they can do something about it now and hopefully improve their risk later. Since we're talking about Breast Cancer Awareness Month this month, it's also important to understand not just how inflammation impacts cancer risk, but also how hormones can do that as well. Now, there's a lot of talk around estrogen and how estrogen promotes certain types of cancers like breast cancer or ovarian and uterine cancers. And there's a lot of research around that, but estrogen also impacts inflammation, and that inflammation estrogen cycle can kind of feed in on itself and increase certain risks of cancers like breast cancer. So again, really important to get your hormones checked, make sure your inflammation is low, talk with your doctor about ways to help reduce your inflammation and get your autoimmune disease kind of relatively in check so that it can reduce risks of other conditions that might come along later in life.